Today is March 23rd, 2022. My name is Charles Suter. Today I'm presenting the topic titled Healthcare Reform. My main message: a public health option, a means to provide affordable health care for all. Private health care in the United States has proven to be effective, but costly, and available only to those who can afford it, or work for organizations that provide health care as a benefit of employment. Too many people with low paid and subsistence level jobs are without the financial means to afford health care. At present, health care for those in the lower income brackets is non existent, except for what the state, community, charitable organizations provide. The public health care option is an alternative option to private health care with its attendant insurance bureaucracy, and would be open to anyone regardless of ability to pay. Private health care insurance would still remain an available option for those who want to keep it and can afford it. The main problem with health care in America is its high cost. The percentage of national income spent on health care is growing into a progressively higher percentage of the national budget every year due to many reasons, one of them being expensive treatments that don't necessarily extend life. Other developed countries are able to provide quality health care for their citizens at a much lower cost and percent of their national budget. Ironically, even by spending twice as much on health care, the American population is not necessarily healthier than those other nations that spend less. Proposition 1. A public health care option for competition with the private health care sector. The public option would provide basic health care to anyone at affordable costs. A special focus would be made on developing community clinics that focus on treatment of most common ailments, preventative health care, and health education, as well as health screening. Would also provide mental health and addiction care, provided for the most common mental problems. A proposed public health care option would establish a separate health care system, run on a simpler model, without the cost of the middleman, that's private insurance, and focused on providing community clinics to dispense primary care, prevention, medical information for common ailments and health problems, with referrals to private health care clinics for specialized treatments as needed. Traditional private health care options will still be available as it is today. The standard of care provided by the public option would be on par with that of the private health care sector, with public health care based on streamlined and standardized best medical practices, with a focus on preventative medicine, again, health education, primary care. All reasonable possibilities for cost reductions will be explored and implemented. Proposition 2. The main features of the public health care option are the following. Everyone is eligible for public health care regardless of their ability to pay. Small businesses, self-employed, uninsured, these types of individuals would find that the public option would be an affordable way to achieve health care for themselves or the members of their organization. Now, everyone currently receiving health care from the U.S. government would shift to the public option. Again, any individual, family, or organization could elect to join the public health care option, with payments based on income, ability to pay, or low standardized rates. All government employees would be folded into the public option, including the military, veterans, and the people on Medicare, Medicaid. The public health care option would also be available to all state and local governments as a means of reducing their cost burden of providing health care for their own employees and low-cost people on welfare whose health care is basically being subsidized by government agencies, such as Medicaid. Again, anyone, business or organization, can enroll in the public option and pay on a sliding scale based on ability to pay up to a predefined standard, but always at an affordable rate. Proposition 3. The cost reduction measures to ensure effective care and affordability would include some of the following: elimination of the middleman costs, insurance, administration, approval process. The primary care doctor would be able to approve care. There would be standardized treatments and costs for each medical condition or service. And again, local clinics would be available for handling all routine medical issues. Plus, they could refer a patient to private specialized care as needed. The responsibility for primary care would be delegated to specially trained staff or nurse practitioners. And finally, development of new best practices, including automation, expert systems for diagnostics, robotics, and nanotechnology. A key feature of the public health care option is affordability. A side benefit to the public option is increased competition for private health care insurance to help them rein in or give them an incentive to rein in their costs and to compete more cost effectively. Funding for the public health care option would come from shifting all current funding by the U.S. government on health care to the public option. The only way the U.S. government can afford to provide health care for all, especially the tens of millions of people currently without health insurance, doing so without raising taxes, is steep cost reductions. The public health care option would be more affordable due to A, standardized treatments. In other words, for X ailment, there is Y treatment. It would be the best treatment currently available. B, commercial best practices. C, negotiated drug prices. D, elimination of middleman costs. E, treatment by specially trained medical technicians at local clinics rather than doctors. And F, application of low-cost technology to support more patients at lower costs, such as expert systems for diagnostics, robotics, nanotechnology, such as laparoscopic surgery. My final message: affordable health care must include a low-cost option as the pathfinder into the future for lower health care costs. The only way to provide affordable health care to every American is to reduce the cost of health care for the nation, is to establish a new streamlined healthcare system, the public option. The focus of the public option is to compete with private insurance in both quality and affordability of health care. The public health care option must apply commercial best practices, such as standardized care, to achieve this goal of healthcare reform and availability to every citizen without an increase in taxes. If this approach works, eventually the nation will progressively shift to a national healthcare system where everyone's health is covered by the public health care option. That's all for now. Remember to stay positive. You'll be happier, healthier, and live longer.